Well, good morning, everyone. Welcome to our webinar. I hope that everyone is doing well. Just wanted to check in and say, I know these are very unusual times and we're dealing with a lot of different challenges, but glad that you all can be here on the webinar. I'm just checking on couple of things before we get started. My name is Courtney Dunkerton. I'm your host with NC-CASA. I'll be presenting with you today. And I'm just checking over the participants. Awesome. Welcome, everyone. All right. Well, a couple of things before we get started. I know everyone's a lot of us are working from home and may have some challenges with internet, and mine actually was kind of struggling yesterday. So if it goes out for a little bit, it goes out. We'll just roll on and, you know, be flexible, and certainly if there's any issues, just let me know in the chat box. I just wanted to direct your attention there. Let's see. Whoops. Hold on 1 second. Okay. Okay, also, I just wanted to let you know a couple of things. At the end of this month, which is actually today, tomorrow, you get a link from NC-CASA if you want to request any kind of certificate for the webinars you've attended, and we'll send those out in May. So just wanted to let you know about that. Also, just wanted to direct your attention to the chat box. We'll be asking some questions and getting some feedback, and if you can locate that and be prepared to provide feedback, that would be awesome. Let's see. Okay, will the recording and slides be available afterwards? We are recording this webinar, so you'll be able to access that. Good morning from Texas. Wow, that's exciting. So yeah, you can access that through our coalition manager after this is done. So, and also I will be referring to some resources and some research, and I can send that out as well. So thank you for asking that. All right. So okay. All right, so let's get started. North Carolina Coalition Against Sexual Assault is an inclusive statewide alliance working to end sexual violence through education, advocacy, and legislation. We are a statewide coalition using a social justice framework. Therefore, our work is done from a strong intersectional social justice perspective. By centering our work around marginalized communities, everyone is served. Some of the work that we do includes organizing and sponsoring statewide trainings related to sexual violence, supporting rape crisis programs, resource sharing and technical assistance, legislative agendas and policy change that's locally and nationally, anti-human trafficking outreach and training and technical assistance like I'm doing now, prevention education, and work on colleges and universities. She is the victim and he is the harm doer or perpetrator. Research shows us about 90% of sexual assault victims are women, and the majority of harm doers are men. Victims and harm doers can be of a non-binary gender. Anyone can be a victim, anyone can be a harm doer or perpetrator. Okay, so this is me. I'm your presenter, Courtney Dunkerton, she, hers. I'm the anti-human trafficking specialist for NC-CASA, and I'm sharing this just to give you a little bit of background of my experience in human trafficking work and advocacy. I co-founded and directed a nonprofit called Alamance for Freedom in North Carolina, Alamance County. That included direct services, outreach, awareness, a lot of training, and also a coordinated community response. I've worked on several initiatives and projects in North Carolina regarding human trafficking, including working on the Human Trafficking Commission Standards of Care, which hopefully will be available in the near future. Also co-authored Equipping North Carolina Rape Crisis Centers to Serve Survivors of Human Trafficking. This webinar is a part of that project. I have experience as a child forensic interviewer, and most recently, I have been tasked to be the regional response team coordinator in North Carolina, working with NCCOT. So I'm really excited about that role, and that's developing as we speak. So stay tuned for that. But I did want to give you this information just to communicate that I have worked with in a human trafficking, what we call standalone program. It was in the context of a rape crisis center, but it was just funded to serve survivors of human trafficking. The over a year ago, Alamance for Freedom actually merged with an existing rape crisis center, Crossroads, which also was a child advocacy center. So I was able to do my work in that context and learned a lot in that. So I wanted to share that with you as we continue. So what this project brings to you is it's intended to strengthen and build capacity in your programs to serve human trafficking survivors. And this project rose from the idea that rape crisis centers in North Carolina, one thing we were hearing was they did not feel prepared to work in that capacity. And so especially when there were other human trafficking only programs that were doing a lot of the work. So the project arose from the desire to meet that need, to fill that gap. So this was the result, the manual, and the manual is available in PDF form, and we could also mail it to you. I will write my, I'll share with you my email address, and you can request the manual hard copy, and there's also brochures. Okay, let me just write. Oh, sorry about that. So it also includes regional in-person trainings. We did one in the East in North Carolina. Everything is on hold, obviously, for in-person trainings. Hopefully those will resume. And we were scheduling one in the western part of North Carolina and in the middle part of North Carolina. And those include a 2-day training. The first day will be training on the manual. And then the second day is a really, really great prevention training on focusing on human trafficking. So it's a 2-day training. Either one can be standalone, but they're really great. And we had a wonderful time in the East, and hopefully we can do that again. Also, technical assistance is available to you all. Reach out to me. Definitely want to help and encourage you all in this. And we also have some brochures that go along with the project. Okay. So one of the things that I can help you with is a technical assistance action plan. And so basically it's just identifying with you what is needed in your program, what needs to be added or enhanced or updated. I can do this in, if it's services or training, and then where to find that support, where to find the language or resources to help you meet that need. And then of course, how to implement those things, and then a timeline. So if you want to reach out to me, I can work with you. And many of you here may not be an executive director in your programs, but we can still work with you in helping you have those conversations if you feel like you need more support from your staff. And so definitely reach out, and we can help you have those conversations. All right. So how did you enter human trafficking advocacy work? I'm going to pivot to the chat feature, and I would love to hear from you all how did you enter? Were you already working in a rape crisis center and you got funded for human trafficking, or you were part of a nonprofit? I would love to just to see what your responses are. And let me check the chat. If you guys could just share in the chat feature. Just want to make sure I'm seeing the chats. Okay, thank you. I'm gonna, okay, so Brittany shared working as a rape crisis sexual assault advocate and realizing the need for human trafficking in my service area. Awesome. Thank you for sharing that. Working at a nonprofit DVSA agency, more specifically worked in Family Justice Center and child advocacy programs as a court advocate and case manager. Awesome. That's great. Thank you for sharing. So as you can see, there's lots of different ways to enter this work, and I just wanted to acknowledge how frameworks inform our practice. So where we begin informs the way we go, how we go about our work. And one of the things that we have learned is if you're coming in from a, not necessarily from the DV or sexual violence field, sometimes the frameworks of kind of a rescue and relocate response can be, you know, there's things about that need to be built, services that need to be added to when you're coming from that practice or that framework. So that's what we're going to talk a lot about that in the next hour or so. One thing I definitely want to emphasize as we acknowledge the diversity of these answers is there's a lot of obviously we're always going to have something to learn. We're going to have places that we can grow, and you're going to have these moments where you go, oh my gosh, I can't believe I was doing my work like that, or I didn't realize that, or I wish I had known this. That's a good thing. That means we're growing. That means we're learning. And as we are interacting with others that may not be in the same space, that may not have the same understanding, that are growing in their work as well, we really want to give grace and space to that. Okay. So thank you for Hyde County Hotline, working as a sexual assault domestic violence nonprofit agency, working now with human trafficking victims. Again, Rape Crisis Center, moved to the role of SARC coordinator. Awesome. Great. Thanks for sharing, you all. So I think we want to do the best that we can do until we know better. And as our friend Maya Angelou said, then when we know better, we will do better. So I'm a firm believer in accountability, honest reflection, but I also feel like we need to give each other grace and space to grow and patience in this. So there's lots of things to learn. Okay, Oasis in Boone. Working with the DA's office, just recently started as primary SA and HT advocate for my agency. Awesome. This is really exciting. That's great. So why is this project necessary? Continuing that thought of encouraging honest reflection, the anti-human trafficking movement in North Carolina has accomplished some really amazing things, really great things. But there's a lot, you know, we have a long way to go. And I think some of these items on this slide reflect some of the places where we need to grow. So we've had a great deal of human trafficking only programs and initiatives in North Carolina. And sometimes the impact of this is the work is drawn away, or rape crisis centers aren't necessarily always included in that work And the impact can be the rape crisis programs don't feel like that they even know how to deal with human trafficking stuff. And the human trafficking folks will say, no, this is our territory, we're the experts, and we'll call you when we need you. And I, that's very understandable how that happens. And what ends up happening is, if the human trafficking agency or organization or nonprofit goes away, then there's a real gap in the community. So what we want to do is build capacity and empower local communities to address human trafficking as it's showing up in their area. And that means the Rape Crisis Center, the Child Advocacy Center, the Human Trafficking Only program, if there is one. So also there are statewide initiatives that are doing some really great work, but they have no meaningful connection to local programs. And sometimes that's just the nature of the initiative. However, when statewide initiatives are perceived as this is the go-to group, this is the go-to agency, local communities aren't not building that capacity. So we really, really want to make this meaningful in our local communities, right? The other thing that we're seeing a lot of, and I'm sure you can attest to this, is there is a real emphasis right now in law enforcement-led interventions that are focused on sex workers or sex buyers. Sometimes these things are called prostitution stings, sometimes they're called human trafficking stings, and they end up being quite coercive. I could talk a long time about this. Sometimes in communities, this will be where law enforcement wants to do their work, and rather than focusing on investigations that are very, very intensive and difficult and resource heavy. So the impact, though, sometimes is people think this is the only way human trafficking is showing up, and this is the only response, and it gets news media, and it's splashy and that kind of thing. So that can that has a lot of negative impact in a community, or that it can. So that's an issue. And then the rescue and relocation messaging, where you identify where a victim is identified, a supposed victim is identified, and they are forced or really pressured into moving out of the location because that's what's best for them. So we've seen some of that and the impact of that, and we'll address that later on. So as I mentioned, lack of confidence in rape crisis centers to serve human trafficking survivors. And also there's a real need for evidence-based prevention model and practice. We do have that service, and I will get to that later as well. But just understanding, I think a lot of HT only programs are not as aware of primary prevention and best practices around that. The message is not, kids, keep yourself safe from traffickers, be careful of the white vans. There's a lot more to that. So there's a real need for us to center on evidence-based prevention models and practice. Mentioned issues with sustainability. Funding for human trafficking is not going to be so available probably one day, and so we need to think about sustainability. So building that capacity in rape crisis centers is just a wise use of our resources. There's gaps of meaningful outreach into marginalized populations that are not being served, or they're just being missed or ignored. And then there's gaps of direct service. So, all right. Oops, so sorry. All right. So we're going to just briefly give an overview of human trafficking for rape crisis centers. Won't stay long on this, but did want to give an overview of it. I mentioned earlier the empowerment or the rescue model, and we want to make sure that we are centering on empowerment, which focuses on survivor choice, and it centers on their expressed needs. It also collaborates with the survivor in what they want, what they are expressing that they need. The rescue model tends to impose services that focuses on removing the person from the situation, right? it tends to say, we know what's best for you. This is a terrible situation and we're going to pull you from it. Or we're going to really pressure you until you agree to be pulled from it. So that, and I may be stating that a little bit more negatively than it needs to be. I'm not judging intentions or motives necessarily, but that has been the focus of a lot of human trafficking services. So the Rape Crisis Center, the domestic violence programs would really understand that empowerment model. We can't, if someone's not ready to leave their situation, and I'm not talking about minors, right? I'm not talking about kids that, you know, need systems involvement. But when a person's not ready to leave, you know, what do we do? And sometimes I've heard human trafficking advocates like, well, I didn't know what else to do with them. They weren't ready to leave. So you're, you know, and obviously we want to have an open door policy. We don't want to ever communicate that unless you do what I think is best for you, you know, we don't have anything for you here. So we really want to center that empowerment framework and bring that into everything we do. Sometimes I've seen programs where there's like this divide where the sexual assault folks or advocates work from that model, but the HT advocates, the HT staff kind of has this other approach that they take. And I can understand how that happened, but we really just want to be very mindful of bringing that, you know, building that empowerment framework into everything we do, right? And seeing when you have, you know, it's like when in domestic violence work where someone's not prepared to leave their abusive partner, you don't force them to, you don't coerce them, right? You give them the, you know, you meet them where they are, you support them, and when they're ready, you know, you make those plans together. Just like a human trafficking survivor, if they're not actively fleeing their trafficking situation, if they're just, you know, if they're coming to you with these other things, we meet them where they are. And if we do our work well, very likely they will call us again. They will show up again. They know, you know, they won't say, well, you know, I've burned my bridges with them and I can't come back. They're going to be disappointed with me because I'm not leaving my trafficking situation or not leaving, you know, this situation that makes me vulnerable, apparently. So that this is really, really important. And so we want to talk about this a lot in our work. So force, fraud, and coercion, that's basically, human trafficking is all about coerced services, whether that the service is sex work or construction work, that's basically what human trafficking is. We want to be careful that we not conflate consensual sex work with coerced sex work. There's a lot of problems that come out of that conflation. We want to make sure that, you know, we need to understand that someone can be trafficked and move into consensual sex work and move back into being trafficked in and out. There's it's not really this, you know, one solid line, that there's a lot of nuance around that, and we need to understand that as we're working with folks who have been trafficked. So thank you, Tommy. Most victims do not understand they're a victim of exploitation, especially if they're being trafficked by their partner. Right, exactly. And so to force that label on them is going to be harmful. And we're going to talk about that later on. So we need to understand, you know, the dynamics of coercion. That's super important. Coercion occurs in a variety of ways. As we know, a lot of the messaging out there is about chains and, you know, barcode tattoos and cages and, you know, the white van. And we know those things happen, right? We definitely know they happen. But a lot of times the coercion will be emotional manipulation, pressure, right? We also know that if it's a minor, we'll talk about minors engaged in sex trafficking, but coercion can involve, there's a lot of drug-based coercion. We see that a lot. I'd love for you to share, you all, if you want to share in the chat box, other dynamics of coercion that you see. Definitely with people who need an emotional connection. Anyone that portrays themselves as a partner or a friend or a protector or boyfriend, girlfriend, partner, those are very, very successful means of coercion, at least the grooming part of it, right? And then the fear of losing that emotional connect, or someone who's filling that need, who's meeting that need, there's that bond, and it's very, very difficult to, well, number one, it's difficult to prove. If you're talking about, you know, being involved in law enforcement and an investigation, it's also very difficult for that person to feel like they can leave. Other means of coercion, I mentioned drug-based coercion. Someone who feels like they don't have any other way out, that they feel trapped. Definitely sexual violence, physical violence are ways to coerce. Threats of abandonment, threats of being reported to law enforcement, being reported to immigration, can be very, very strong ways of keeping someone controlled. Also, owing a debt, when someone feels like they can't leave a situation until they pay this person back, and maybe the payment is going to be sex work. Those are ways that traffickers coerce and control. And then, because there's so many different means of coercion and control, the survivor's needs are going to vary. We might be working with folks who have just been pulled out of a trafficking situation, and they've been trafficked for like 2 years. They, you know, they are starting from ground zero as far as, you know, rebuilding their life, if that's what they want to do. But you also could be working with someone who was trafficked when they were 15. And they have gone on, and maybe they're really dealing with some other things that relate to that. We could have, you know, you could be working with someone who, you know, left the trafficking situation and they need a job, and they need someone to talk to. I mean, there's a variety of needs for survivors. It's not a one size fit all service, right? So Tommy shares the ethnic demographics, misrepresentation, as well as the chains, rope cages. Yeah. And communication pieces are problematic in presentations. Yes, yes. New Orleans group has excellent presentation on how we communicate the facts without marginalizing and making sure the picture. Yes, this is really very important in our advocacy. It's amazing how much we know, how much we've learned, but we still will pivot to those sensationalized pictures, right? And those images, and they really, there's a lot we can say about that. You know, the disembodied hands, the poor, you know, rescuable looking person in the corner of the room, right? One of my colleagues says, you know, if you want to have a typical picture of a survivor, just have someone who just looks like they need a friend. So it's, yeah, a lot of that misrepresentation, those false narratives really do a lot of damage. I don't know, this happened in North Carolina, was it last year, early this year? Time is kind of meaningless right now, honestly. But there was this, I think there were a couple of so-called human trafficking stings. And then the next several weeks, at least in where I live, there were just all these Facebook, social media panic things about the white van showing up at the gas station or the Walmart parking lot. And it was getting so bad, like the law enforcement they were having to put out statements like, while human trafficking is a problem, you know, this thing is not human trafficking. So, you know, we have, if law enforcement is having to address false narratives, you know, we have a lot of opportunity to do that. So, you know, let's be proactive in our advocacy and in our awareness. So yeah, thanks for sharing that, Tommy. Okay, so let's go on. Minors engaged in sex trafficking. We know that labor trafficking, minors engaged in labor trafficking, the definition around it is there has to be force, fraud, coercion to be considered labor trafficking. With sex trafficking, if it's a minor, anyone under 18 cannot engage in commercial sex. They cannot consent to commercial sex. In North Carolina, however, if a minor is being trafficked, labor trafficked, or sex trafficked, we have to report that to DSS. We do know that now. But a minor engaged in sex trafficking is not to be criminalized, is not to be arrested, thankfully, because of our safe harbor laws. And they are to be considered victims. So what are the ways, if you can really quick share in the chat box, what are the ways that this shows up in your communities? I know for the work that I did, a lot of runaways were involved or being groomed. That's how a lot of trafficked youth were identified in my community. There was just a lot of running away and getting connected to gangs or other known traffickers. Minors that are engaged in sex trafficking are usually going to involve, there's going to be a lot more systems and protocols involved. So there's possibly going to be law enforcement involved, CPS, our child advocacy centers, juvenile justice, those things. And I'm not sure how many of your programs you all serve minors, but advocating for them is going to be much more complicated, or can be complicated, because of all the systems involved. And this is where we see this is where we can see a real lack of awareness in our community about human trafficking. Yes, minors should not be criminalized, but that's not the way they're treated, right? Oftentimes, this is where we see a lot of systems of oppression and marginalization show up. We know the folks in our communities that get more sympathy than others, right? And so we see those things show up when we have, say, a 15-year-old who, is not valued very much in the community. And we see those, those things show up. So there's a lot of advocacy work that we have to do. A lot of systems advocacy, actually. I want to share with you an article, and I can send this, I can email this out in a resource list, but there's a really great research article I just came upon a few weeks ago called Vulnerabilities Relevant for Commercial Sexual Exploitation of Children / Domestic Minor Sex Trafficking, a Systematic Review of Risk Factors. Really, really good article that goes through the risk factors and has just a really great way of explaining them. And so I definitely want to share that with you all. I could talk more about that, but we're going to need to move on. Okay, then marginalized populations, tremendous gap in human trafficking work here. We really need to be aware of how systems of oppression shows up in our community, and because that's where we're going to need to do the work, to do the outreach to where marginalized populations do have equal access to our services. Again, could go on about that, but that's and we talk about this, we say this, we know this is an issue, but when it comes down to the local community, are we really seeing people from marginalized communities accessing our services? Do they feel safe in accessing our services? And that's where we really need to ask the hard questions. If you're not serving LGBTQ youth in your programs, there's reasons for that, right? And definitely reach out to NC CASA to help you to talk about that, and we can support you in that. Oh, I love that West Coast Children, the See It tool. That is an excellent tool. Thank you for sharing that, Tommy. I highly recommend that. Working at a systems level and locally engaging with the child advocacy centers to do care coordination. That's awesome. Using it statewide. Yeah, that's really great. Thank you for sharing that. Yeah, it's working with child advocacy centers is really important. They do their work. They're very different. There's going to be law enforcement involved. It's going to be systems involved. It's going to be, but at the same time, they're a very important part of our community, and we need to collaborate well with them. So, all right, I'm going to continue. All right. So I'd like to hear from you. You may not feel comfortable in answering all these questions, but is your agency currently serving human trafficking survivors? And if so, what services are you primarily providing? Have you personally worked with survivors of human trafficking? And if you want to chat or send a chat to me personally, if you're not comfortable with sending it, that's fine too. I totally get that. Have you personally worked with survivors of human trafficking over the past year? How many? I'm going to skip the one about sexual assault prevention programming. Okay, how about this? Have you felt, or do you feel prepared and confident when working with survivors of human trafficking? Does your agency provide adequate ongoing training to all people with direct client contact working with HT survivors? That's more than an hour, a basic 101. And then what are the most significant service gaps in your community agency? I would love to hear from you if you're comfortable in sharing those things. All right. Three minor clients, CPS of all. Hey, Tamika. Okay, thank you for sharing that. Primary services, financial, yep. Okay. Project Fight, we love Project Fight, providing emergency shelter to people fleeing human trafficking, other community partners, awesome. Thank you, Caitlin. Amber says, Safe Flight at Hendersonville is here. Hey, we were part of the rapid response team, Our Voice, yay, in Asheville. Yes, they are amazing. So the rapid response team, yeah, I'm going to talk about that in a little bit. Oh, thank you so much for sharing that. Yes, primary gap is financial. Yeah. We have an emergency shelter, CEC, Family Justice Center. Okay, great. Well, hopefully we will be heading out west sometime in the future. So I'm going to make a note. I'm definitely going to talk about the rapid response teams. I'm really glad you brought that up. Thanks for sharing, you all. I appreciate that. So I'm going to assume, and we have good reason to say this based on feedback we've gotten, that there is a significant need for more training on human trafficking and serving survivors. And many people in the rape crisis centers do not feel prepared to or confident to serve. And a lot of that has to do with either the various needs or the assumptions surrounding serving survivors. And we'll talk about that. You know, especially as you have these stings and law enforcement led operations and programs that work closely with law enforcement, some folks think that it all looks like that, and it doesn't. There's many different ways we can serve survivors, just like there's many ways to serve folks who are showing up for sexual assault and DV needs. Transportation will be a big struggle. That is such an issue in the rural communities for sure. Yep. Relational based approach, working with children. Yeah, Tommy, I really would love to catch up with you later. It sounds like there's lots of really great resources we can share. Awesome, thank you. Okay, so assuming that we all would like to be more comfortable and confident in sharing and serving survivors of human trafficking, you know, we want to continue to build on these things. So thanks for sharing. We will continue training. Okay. So just keep in mind as we continue, sometimes when we talk about human trafficking survivors, we talk about them as if they're not in the room. They're already among your clients. They're at your prevention outreach events. They're they're among your staff and colleagues, right? You know, we may think that we're able to identify survivors, but remember, not all trauma is apparent. Not everyone shares all or any of their story, and we're not entitled to it just because we're HT advocates, right? So we can't assume that human trafficking survivors are not present when we're doing these things, and we need to be aware of that, because we can do real harm if we talk about them as if they are not in the room, as if they are other. So I just wanted to mention that before we continue. All right, so let's go through a direct services overview. So one of the questions when I do trainings, one of the things I ask, so are human trafficking survivors' needs different? Do they require a completely different set of services than the other folks that you're serving? Do they require the same? Do things need to be tweaked or enhanced? And I say yes and no. The very same services you're offering your sexual assault folks are the same ones that human trafficking survivors need. Yes, there are a lot of situations with trafficking survivors where their needs are very intense and complex, that require, you know, more extensive services, that require more intensive case management, and quite honestly require, if it's possible, for advocates to have a lower caseload. So we want to honor that, right? So yes, there are specific things that we need to be mindful of. For instance, we know that a lot of trafficking there's drug-based coercion. We know, so this is an issue. So if you have someone who has been trafficked and their heroin use has been, you know, controlled by a trafficker, there's a lot of issues with it. There's going to be a lot of services that person needs. The first thing is detox, and you know, if they're willing, if they want that, that's what's going to be important, right? Someone that's in constant drug seeking mode is going to need a lot of supports, right? So that's an example. There's a lot of times housing and transportation, like we mentioned. So yes, but core services, what kinds of services do folks need? They show up, they need support, they need trauma informed space, they need information, referral, crisis counseling. You've got your crisis line, hospital and court accompaniment, those basic things. What is unique about human trafficking? What do we see that is sometimes you know, something that's a little bit different? A lot of times our services may need to take place off-site. So it's not necessarily like people are making appointments and showing up at the rape crisis center, right? So there may be referrals or calls from other agencies in the community, someone at the hospital that is there for something else, not a SANE kit, but they're there for something else and they disclose, or they're at the Family Justice Center, or they're involved somehow in law enforcement for something else, right? And the detective realizes, or the investigator realizes, oh my goodness, this person may be trafficked. Or they're at court and their defense attorney detects there could be trafficking. So we get phone calls, right? And it's really helpful if you have in your protocols, if you have a system where you can provide those services off-site. And we can talk about that. There's lots of issues around that, but that's, you know, or going to the jail or going to other places to provide. I know that, you know, depending on where your program is located, where there's a lot of law enforcement around, you may need a second site to meet. I know that there's programs that do that, that there is an established a second place. It might be a whole building, it might be a room in a building that feels safer, that some folks will feel safer to access. So you want to think about your community and how it's made up and what populations are there, and you know, where others may feel more comfortable accessing services or having a conversation. So we definitely want to be creative. We want to think outside the box. I'm excited to be the regional response team coordinator. We're not calling it rapid response team anymore for some, you know, well, for a couple of reasons, but I'm excited to start those calls back up so we can start collaborating on these issues together and talk together about these things. So referrals and self-reporting, not, you know, I'm guessing that not as many people show up saying, hey, I've been trafficked. I know in my own program that didn't start happening till about the last 2 years that I worked, where survivors were sharing our number with one another. And they would say, hey, you know, I've heard that you, and whatever they might say, like help people get off the street or help people get out of prostitution. That was the way, that was the language they used. I kind of knew what they meant. So that started happening at the end, but they weren't making appointments and showing up necessarily. It may be that, you know, an investigator gave them my number. So there's going to be different ways of getting that information to connect with potential with survivors. So one thing that's really important is think about how survivors are accessing your services, and hopefully they're doing it in a multitude of ways. It's really important to establish referral networks. And so we want to go to the agencies and talk about the services we do, that you do, and how someone can access, understanding that there may be a lot of barriers to overcome to even get to those. We want to lower those barriers and make it easy for people to access services. So, but establishing those referral networks, and definitely, you know, educate folks in your community, educate the criminal justice system, educate people on what human trafficking, how it's showing up in our community, and how folks can access support. All right, intake and screening. I wanted to mention this because a lot of human trafficking programs are funded to serve human trafficking survivors. So there has to be some sort of, proof is a terrible word, but some sort of, you know, reason, justification for serving them. So there's like a tool or some sort of screening that has to happen. How to do this in a trauma-informed way obviously is very important. So there's different ways we can go about that. Let me just jump to this next slide. So identifying survivors. A lot of times program funding requires HT screening. So what tools and resources do you use? You can use a very quick, kind of rapid one-page tool that just gives you, that goes through these, you know, this is why, you know, this is how this person's presenting, or these are the things that are possible indicators of trafficking. I know there is the National Human Trafficking Training and Technical Assistant. They have a one-page, well, they have a whole toolkit, but a one-page screening tool that's very basic. You don't have to go through the tool and ask the person. It's just in their conversation, you know, as information comes out, things are indicated. So you don't have to, like, number one, number two, number three. And depending on the person, they may be in such a state of crisis that you sitting down with a piece of paper and a pen is extremely upsetting. That has been my experience more than a few times. So where you're just talking with the person. We have found that sometimes having two advocates in the room with the person, so one sort of writing down and the other person is engaging more in the survivor in conversation, just to help in a way that just feels more comfortable and natural to that person. Just obviously you're going to have lots of different approaches. How do you administer the tool? You want to be very, very aware of their comfort level, their sense of safety. It may be that you write those things down later, and of course there's protocols around how you keep notes and keep files and that kind of thing. You want to be careful about that. How do you get informed consent? That's going to be a challenge, especially if someone's accessing your services and they are under the influence. So you're going to have to talk to your supervisor around those things. Um, how are other agencies in your community identifying HT survivors? And that's where our systems advocacy comes in, and we're educating our community. So just, choosing those 3, 4, 5 agencies that will most likely provide you with referrals. You want to make it a point of educating them. And let's see. And this is going to be a way to influence our outreach practice as well. So other tools that are helpful, the West Coast See It tool was mentioned. The Vera, there's a long and short version. I have used the Vera tool before, especially with survivors of labor trafficking that might be from the immigrant communities. That can be very helpful. Sometimes it is okay to go through a tool like that with the survivor. Just use your best judgment. You definitely just want a variety that fit the situation, that are most appropriate. Sometimes, talking about intake, going back to intake and screening, depending on the person, depending on how they showed up, like if, well, it may be more appropriate for that person to just have a nap and some snacks before you do the intake, depending on how they're showing up at your program. So just have those spaces in mind. Safety planning: is the person actively fleeing their trafficking? Is the person, are they in crisis that's somehow related to trafficking? Lots of survivors are involved in the criminal justice system, and there's lots of crisis around that. So, and also understanding safety is going to be a series of trade-offs with trafficking survivors. There's going to be just there may be lots of things about their life, about their situation, there's going to be no perfect scenario, right? You're not going to get all the things exactly right. We know this. Sometimes the only ride a person can get to work is and if they don't have their job, they'll lose their housing, they'll lose the custody of their kids, so their only ride to work is someone that may have been involved in some of their trafficking or former drug use or whatever. So there's things like that. They're just going to be trade-offs of that person, that you're going to work through with that person. And this can be really hard. I don't know if you all have this experience, but this can be really hard working with other advocates that may not be used to some of these challenges, and they can comment like, that's crazy that they're riding with that person. And this is where confidentiality is so important, because, well, yeah, it's just very, very important. Other people can really, really look down on survivors of human trafficking and the choices that they have made to get to where they need to be. Because like I said, not everything's perfect. And from the outside, there's just a lot of room for judgmentalism, and we have to, ahead of time, educate our staff, educate others that we might be working with in the agency, in the program, about what the typical barriers trafficking survivors have to go through to get to a place where they can be on their own and be independent. And all those choices might not be just like, packaged up in a beautiful, box with a bow around it. I mean, this is going to be really messy, and it needs to be okay. I think for me personally, some of the hardest days in my work with indirect services was when fellow advocates or fellow people like from the START team or whatever would just talk down about trafficking survivors like they were less than. And I was always surprised about that. But because there's so much bias about people who have been incarcerated, or have done drugs while they're pregnant. I mean, yes, of course, those things, the drugs while pregnant is not a good thing, but a lot of times that's where our clients are. That's where the survivors are. That's what that's part of their lived experience, and we have to be you know, fighting really to meet with them, fighting with our, you know, doing the work with ourselves, but also, you know, advocating in our staff, you know, to meet them where they are and to not be judgmental. But it shows up. It shows up. We have to do that hard work. Okay. Safety planning. So safety, yeah, we mentioned that. Case management. So this could be very comprehensive. This can be just maybe getting a couple of services in place, but for some survivors, it can be very intense. And we have to sometimes plan for those things. Sometimes there may be situations where you might have a few clients and or folks you're working with, and you just need to clear your schedule because you know that this is going to be all day, every day, you know, helping these folks with some of their things, some of their needs. We are always going to be collaborating with other agencies, and that brings its own set of challenges. So we want to do the work ahead of time to build those collaborative partnerships and discuss processes, discuss how we're going to work together. The key to collaboration is communication, communicating with the survivor, collaborating with them, letting them be part of their service plans. Any of you who have done case management would like to share, if you would like to share some key things, that would be awesome. I know that, you know, some of you all, or someone mentioned working with Project Fight. Do I have formalized MOUs with the collaboration? I think that's actually, having an MOU, even a general one, is very helpful. Yes. And usually grants require that anyway on some level. But it is very helpful to have some sort of MOU that outlines how you're going to be working together. And then just, you know, definitely, yeah, information sharing challenges, that is, and doing that work ahead of time, like, can help with that. So you're educating your partners on, you know, this is how human trafficking is showing up. There's different ways. It's like this sometimes. It's not always like this sometimes. Please understand, I'm not going to share everything about this person, or I can't. So you have those conversations ahead of time. You want to do as much as possible, so when those services are engaged, that you're not having to re-educate everyone on human trafficking. So, you know, you can, especially when it comes to emergency shelter, you can have some plans with another agency with how you're going to go about that. If you're accessing shelter services with a domestic violence program, definitely work some things out. We're going to talk about shelter issues in a little bit. So, okay, follow-up. What is follow-up going to look like? Sometimes programs require surveys. Surveys can be very triggering and very intimidating and scary to trafficking survivors. So maybe you have a different way of collecting some sort of feedback. We have had clients who are aware of how people fundraise for human trafficking, and were very suspicious how their information and stories were going to be used. And that was sad that they even had to deal with that, but that was a very real thing. So keep those things in mind. Engaging systems, I've mentioned that many times throughout. Identify your top 5, your top 10, and think ahead of time and how you're going to work with them and what they need to know in order to provide seamless services and collaboration with other programs. And that takes a lot more work. I think that takes as much work, building those partnerships and building trust and talking through things ahead of time before you're working with a particular client. That can take as much time as working with the clients, working with the survivors. I'm sorry, in my program we call them clients sometimes. And so just to encourage you there, and the challenges is going to be confidentiality and communication. there's a great deal of curiosity that people have about human trafficking. So you'll get questions a lot about specific survivors, and, you know, obviously confidentiality is key. All right. Okay. I don't know if you've all seen this pair tool. It is excellent. It's for, I'm going to pull it up it's for healthcare settings, but I have used it. I think the language that it uses is extremely helpful. And also, so it's like a 3-page tool. It has this about how to engage survivors. Then, you know, a little thing about sexual violence, child abuse, and then just a page of resources. So this is a very helpful thing to give to people, particularly if they say, how do I talk to a survivor? And again, this is for a medical setting, but it's very transferable. So it goes through confidentiality. It talks about, you know, how to approach survivors. And then I love this if a patient declines materials, and respect the patient's decision. It's very empowering. So I use this, and you can train on this. You can share this in your SART teams. I highly recommend using this tool. So I wanted to mention that. Oops. Okay. For some reason, this goes all the way back to the beginning. Okay, building cultures of care, trauma-informed practice. Actually, I wanted to mention a couple of tips I had written down here. When you're engaging survivors, if you are aware of gang affiliation, and just as a practice, be aware of, you know, I just would never wear blue and red. Be aware of the gangs that are represented in your community, and just be aware of that. That may sound silly to some of you, but the pair tool, by the way, I can send you links to the pair tool, but you can also just Google it. All the things that I mentioned in this webinar, we will send you a resource list. Thank you for asking. And also, as stories, the stories are not always as extreme, right? As we see the stories on in the movies that make the documentaries. However, there are stories that are extreme and that are very, very challenging to hear. We want to work very hard to not be shocked. We want to work very hard to be present for the survivor, and to not be like, oh my gosh, that's the worst thing I've ever heard. How, that kind of thing. We want to work hard to meet them where they are, and to empower them, and to speak to them on a strengths-based, framework. So we want to check our bias and our privilege as we're engaging. We want to make sure that we're not looking like I share this story because I had our Family Justice Center. I was part of that, and I had a badge, and it was at court. And one of my friends that I worked with said, you might want to take that off because it looks like you're a social worker with CPS, and that could be very triggering. It's like, oh, okay, thank you. So just be mindful of those kind of things. If we look like a cop, if we look like, those are very real issues for survivors. So we just want to be mindful of how we are presenting. And you can talk to if you have a no jeans rule at your program, you can talk to your supervisor about that. Okay. All right, building cultures of care. This is from a resource from the Resource Sharing Project. Just notice how person-centered this is. And I'll go over it briefly. So safety, what's your visual space look like? Are survivors provided with clear explanations about services and processes? And that's really important, especially when someone's in a state of crisis and everything is very overwhelming. Many things can be very triggering, especially our spaces if they're, so we want to be very mindful of that. Building trust. How is informed consent defined and maintained? It's very important that as we're going through explaining consent, explaining, you know, all the forms, if you're, you know, they're signing forms, who's going to have that information? Who's going to, how is this information going to be used? Who's going to see this? To be very clear that they understand and feel comfortable with it. I have been in many times with a survivor where they did not want to see a piece of paper, like I mentioned earlier, or sign anything. And that's just where they were. So be prepared for that. Coming in with a big old stack of paperwork is not going to be very trauma informed. So just think through those things ahead of time. Choice. How much choice does each survivor have about what the services they receive? And if you think about someone who's been trafficked, whose choices have not been, you know, that has not been important, obviously. You really want to center that and just emphasize it, even when a survivor can say, I'm sorry, I just don't want to go, I'm just not ready to leave, or I'm not ready to do this thing or accept this thing. I'm so sorry, I promise I'll call you. Or, you know, a lot of apologizing, and you just want to make sure they know you don't owe me anything. You don't even owe me accepting this bag of stuff, right? Or whatever it is. And I'm here for you. You tell me what you need, what you want. And there's just this, so being aware of those power dynamics, and then feeling indebted to us, and feeling indebted and somehow needing to pay me back. That's a lot of times we'll see that in survivors, because that's how they survived. That's how they've gotten through their situation. So there's this real need to please. There's this real need to make sure that, you know, I'm not mad at them. And so, but we want to make it really clear that everything we're doing, it's all about, you know, them choosing to access our services if they want to. That makes sense. I hope that makes sense. That was a dynamic that I wasn't prepared for, that I wasn't trained for, but that I learned from working with survivors. So that's where that rescue, that, you know, I've got to be the rescuer, I've got to be the savior of the situation. You make it all about yourself. That and one thing about trafficking survivors, many of them, they have learned, they have survived by reading people really well, and they can detect dishonesty and disingenuousness very well. And so it's just best to be very honest, and they will know if it's all about you many times. So that has something that I've learned as well. So collaboration. Are survivors involved in the development of programming? Are you bringing their voices in? Are they centering in your service plans? And we want to be, when we've talked about that. Empowerment. Does the provider have people with lived experience in key roles? We definitely want to learn from survivors how our programming is. We want their feedback and involvement. Cultural competency. How does the agency prioritize meeting the needs of survivors from diverse backgrounds? And I wanted to share, I'm going to share this. This is a resource that I have found very, very helpful. It's from the National Latinx Network, Casa de Esperanza, Trauma-Informed Principles Through a Culturally Specific Lens. If we had, time is slipping away, I'm gonna focus on a couple of these. Do you have a formal survivor-led group who gives feedback, informs practice? If anyone that's has a survivor-led group, that would be great if you would like to share anything about that. That is ideal to have a survivor-led group. I know in North Carolina that's a gap that we are addressing, that some are seeking to address. I'd love to hear from folks on that, if anyone has anything to share. So from the Trauma-Informed Principles resource, I wanted to center on principle number 3. Let's see. Understand the origin of trauma, including historical, collective, and the intergenerational transmission of trauma. Do not minimize the resiliency, wisdom, and strength of survivors. They have much to teach on how to heal from trauma. In many of our communities in North Carolina, this needs to be, this is going to be challenging, where there is a lot of systemic oppression, historical oppression from with many different populations, and we want to, when we're working in our SART teams, our MD teams, when we're working with other agencies, and this is not understood, we really want to bring that into focus. We really want to advocate on this in language that is understandable. This takes a lot of patience, this takes a lot of effort, and we want to continue to make our community partners aware of the historical trauma for many groups. I just wanted to mention that. The other thing is that we want two-way learning communities, right? When we do our outreach, we want to learn from other groups and other communities. And I really, really love this article, and I will send that link to you all as well. This outlines this, and again, it's a good resource to train on and share with your community partners. So, all right. Oh, I'm gonna go back. Okay. I wanted to have a couple of minutes to share about your own programs, thinking through safe physical spaces. I know with the program that I was involved in, we were able to not design, but just really think through the space that we had available to us, our facility, in terms of human trafficking survivors. So that was really a great thing to do, where we had rooms that were available where, moms with their children could be, where there could be, not a pull-out couch, but like a big recliner where someone could just sleep and rest until they were ready to do any kind of initial intake or introductions. So how does your facility currently foster a sense of safety and security for traffic survivors? If you all could just share if you have any creative ways, things you've done, and then what are some creative ways your facility has or could better use its space to foster a sense of safety and security? So just kind of thinking. I'll just give you a few minutes to share. Okay, thank you, Tamika. Daycare and Justice Center, separate building than the Justice Center, because I'm assuming that there were the presence of law enforcement there. So having a second, right, having a second site, just understanding the presence of law enforcement is very problematic for many, and not feeling like they could feel safe there. And then mobile outreach. Could you share just a tiny bit about the mobile outreach? Do you mean, I think I know what you mean, just going into the communities and providing services there? Anyone else have anything you've done with your facility that changed it, thought about it? Some people feel very safe in front of windows. Some people, windows are very scary. So if you do have a room with windows, you want to have coverings that can be closed. And again, it just represents survivors have different needs, different sense of safety. We want to be aware of any overrepresentation of gang colors, who else is in the building, if you do have a building with law enforcement or other folks that may, you know, whose agencies may represent. It just may be difficult for some survivors. Think about that. We had kind of a plan for flow, like who, if law enforcement or others were there, these, you know, they couldn't use this hallway, they had to go down another hallway. If there were a lot of people, because some of the folks that we served, either sometimes they came right from the streets, sometimes they came right from jail where they put on the clothes that they had when they were arrested. I mean, it might be some, and they felt a sense of, they felt a certain way, didn't want to be seen by other people. So we wanted to be able, we didn't want them to have to walk through a whole waiting room full of people. So just giving that thought to how to address that. We had blankets on hand, or we had clothes on hand in case someone wanted to just change or just have a blanket over them. We had a room that was arranged very comfortable. We had a couple of rooms, but one had sweatshirts, socks, comfy slippers, stuffed animals, comfy blankets, pillows, anything that you could just hug and kind of hold. So and we had that for survivors that they could access if they wanted to. So those were just some ways. Partner organizations allow private room. That's awesome. So if you are working with a partner organization, talk ahead of time what room that you'll be able to use. And if you're able to, if there are some things about that room that you can change, if you're able to, you know, think about that, or just bring with you, you know, a bag that has like a blanket or, you know, whatever it is, things like that. So just have that with you, or ask them to keep those things on hand. So there's lots of ways we can be creative, and always, if it's appropriate, ask the survivor, you know, if you're in a place in your communication with them where you can say, hey, you know, what are your thoughts on this space? When you first came into our facility, what were your thoughts? What could be different? And I mean, I have learned so much from survivors giving me their feedback and you know, and following it. It's very, very valuable. Things I would not have thought of. Portable sound machines. Oh my gosh, so important. Sound machines everywhere. And those are things, if you can't afford them, you ask your community to donate. Awesome. Okay. Okay, let's talk briefly about shelter and housing. We know that this is a huge just a need and a challenge. There's lots of challenges. I won't say problems. There's lots of challenges around this. I'm going to try to go through this a little more quickly. I would say, as much as possible, have a variety of shelter options available, and have those protocols and processes worked out ahead of time. If you do access a hotel, have something ahead of time where you have a code word, an alias, a payment plan. You're already, so you're minimizing a survivor having to give their name, having to give their story. But, you know, sometimes the folks that we work with, they experience a lot of bias when they walk in, depending on, you know, what they look like, and people can treat them a certain way. And so we want to minimize that ahead of time. We want to think through those scenarios ahead of time and try to minimize any harm that they may experience because of who they are, what identity they hold, and you know, that's just part of our job. That's part of doing this work. So what shelter options in your community and in your referral networks? And this is where you do want to connect with those regional response teams and other referral networks to have access and understand the processes of intake and that kind of thing. So what are the circumstances when you offer shelter services? Do you always offer shelter services? When do you? When do you always offer them in town, or do you have transportation arranged? How do you do that? Are you aware of the requirements and intake processes? We have to do our work, right? We have to have that information ahead of time. Are they welcoming of all survivors? We could talk about that all day long, right? How do they treat trans folks? How do, and again, ahead of time, ask specific questions and get all the information, because if you're working with someone who, you know, and that is a shelter option they want to access, give that person all the information that you can give, so they can make the decision whether or not to access it. Because there's going to be less than ideal situations. It may, and we want to do our work on our end in giving that accurate information. And yeah, what are their practices with trans and gender nonconforming survivors? Detox, residential treatment, and other emergency care facilities. Know the ones in your community, know the ones around in your surrounding community. Before you need them, you will be very glad you did the work ahead of time. If there is issues with a particular shelter, if there's shelter ejections and exit concerns, those are the questions you ask. You know, when do you have to ask someone to leave? What are your safety protocols? What are your intake requirements? Sometimes the questions they ask are very invasive and maybe very, you know, cause harm. So those are the things you want to do. And sometimes you might want to work out with a program where you can simplify the intake process, and maybe you have a relationship like an MOU or just an informal relationship, like this is when we refer to this program, this is the work that they need from us, right? So that kind of thing. Some programs, some shelters want the type of want a lot of drug history, substance use history, that kind of thing, and just let the survivor know they're going to ask you questions about this and this and that. You know, are you okay with that? So again, just do your work ahead of time as much as possible. Yeah, prepare a survivor with all the information they need to make a decision. And if they do not want to access that, we might get pressure from other agencies, like they need to go to a safe, you know, they need to stay in the shelter. They can't go back on the street, because sometimes, you know, people are invested in their investigations. You might have a prosecutor that is really frustrated with you that you don't pressure that person into staying with grandpa because that's going to be better for them. Well, if your 20-year-old wants to go back to the hotel and party, you know, we don't kidnap, we don't traffic, we don't, you know, we have to support that person's choice. And again, ultimately, if we do that, if we do our work well, that person will leave feeling respected and supported. It's very likely they will call back, they will call again. So anyway, so we could talk a lot about shelter, and this is people who run shelters, I mean, I've heard it's very difficult. I mean, it is very, very difficult. There are so many issues. You know, there's your survivor safety, but there's also safety of the whole place. And I really, you know, anyone that runs a shelter, you know, boy, you've got my respect. So yeah, law enforcement likes the victim, witness, detainer idea. Oh yeah. And I'm sure you've heard that, you know, jail is safe, jail's best, safe housing, free detox, right? Yeah, we want to we want to educate folks on that. Okay, so if someone calls a shelter asking for a resident, they must provide a password. If we say, and there's issues with phones, right? You know, you don't want to deprive someone of their freedom to call someone, but some shelters ask you to surrender the phone at the front. So is all, you just have to, a lot of our safety discussions, they're all trade-offs, right? And if the survivor can make that decision, like, yes, I understand, I have to give my phone, I have to do that's fine, I'm okay, then we support that, right? So yeah. Okay, time is fleeing, so I'm gonna just quickly mention, human trafficking work requires individual advocacy. It requires systems advocacy. We do a lot of systems advocacy, a lot more, I think, than we might realize. We work to change a service system, groups of persons who share a similar problem, right? The systems that are really important are all victim service agencies, criminal justice agencies, our own agency. I mean, there's a lot of times we have to challenge, or ask questions like, why do we do it this way? Is there a way we can accommodate this survivor or survivors like this person? Can we make some enhancements in this program? Okay, moving on. Outreach. Who are the vulnerable populations in your community? Know them. This is some examples here. Again, if they're not accessing your services, it probably means they don't feel safe enough to. They don't feel that they have access. So work with folks who are working with these folks if you need to. If you don't feel like you're at a place where you can have a successful program to immigrant communities, who's serving those communities? How can you work with them? So start there. Okay. We have a prevention person in CICASA who is amazing, Christy Croft, and they have done some wonderful work with HT prevention. This has been a significant gap in North Carolina. A lot of human trafficking prevention has not been truly primary prevention. So if you have some questions about that, reach out. We are on the project team for a Teach to Reach, which is an evidence-based curriculum around sex trafficking for high school and middle school, and we are very excited about that. I'll send you a link to that. Educating advocacy on safety planning, working. Yes, we are educating advocates on safety planning. I wish I had more time on that. I love the 5 domains of well-being as a guide around safety planning, and I would encourage you all to look at that as well. All right, that concludes this webinar. It went by really, really fast. If you, I wish we had time to do some breathing, but we don't. So I encourage you after this webinar, take a few minutes and think about how you're building resiliency individually and organizationally. If you all are interested in having that conversation and would love to talk to you about that. Whoops, and then wanted to, I don't know why this does not. And please reach out to me if I can help you in any way. I'm really excited about what I do. I love my job. I love talking to other folks in programs, how to build capacity to serve survivors. Any of the things we touched on, I'm definitely able to talk. I'm not in the office. I'm doing, obviously I'm working it from home. I would love to arrange a conversation. We will have more webinars. Reach out to me if you're interested in learning more about the regional response teams. If you're a part of one, I'm looking forward to contacting you at some point. But I want to also start thinking of doing like monthly human trafficking survivor, human trafficking advocacy chats. Aw, thanks, Tamika. Yes, I will post a link to the prevention model and we'll do that. And please reach out, and I hope you all have a great rest of your week. And thank you for the amazing work that you do. You guys are my heroes, and I want to support you in any way I can. So look forward to working with you, and bless you all. Be safe, be well, take care of yourselves.